Hello, my name is Jaime Wasik, and this is my volunteer chat. We are going to be recording a 30-minute head-to-toe assessment for Maryville University. Um, Before we started, Chad emptied his bladder and put on a gown. I had washed my hands. We obtained a full set of vital signs, including height and weight. On our way back to the room, we evaluated Chad's near vision with the Romberg chart and his distance vision with the Snellen chart, which also tested his optic nerve. Okay, so now I'm going to move on to the inspection of Chad's head and face. The color of his face is even throughout. There are no obvious rashes or wounds. I also note that his skull looks normocephalic and his facial features are symmetrical. His nose and mouth are midline, and now we'll move on to the palpation of his scalp. We will gently palpate his scalp, noting any lesions, bumps, areas of alopecia. His hair is evenly distributed, and his scalp moves freely over his skull. Okay, now I'm going to move on to palpation of Chad's facial bones, looking for areas of tenderness, rashes, lesions. While we're here, we will palpate the frontal and maxillary sinuses, looking for signs of swelling and pain or tenderness. We note that his eyebrows are even and the hair is distributed evenly. There is no evidence of periorbital edema, and his eyelashes are distributed evenly as well, and they curve away from the globe, excuse me. Okay, so now we are going to palpate Chad's TMJ, having him open and close his mouth. Noting any clicking, popping, or locking. This also tests for the trigeminal nerve. Chad, I am going to have you smile, clench your teeth, raise your eyebrows, puff out your cheeks, stick your tongue out and move it side to side to test your hypoglossal nerve. And last but not least, go ahead and squeeze your eyes tightly. Okay. Now we can move on to inspection of Chad's eyes. We note that they are again even and symmetrical. The eyelids are free of swelling and redness. His conjunctiva are white and free of drainage and redness as well. Now I'm going to go ahead and palpate Chad's globes, noting that there is no pain upon palpation and both orbits are firm and round, easily pushed back into the orbit. Okay. While I'm here, I'm also going to gently palpate the lacrimal apparatus, ensuring that they're not firm or extremely tender. And now I'm going to assess Chad's pupillary responses. Okay, Chad, if you can pick a spot on the wall and just keep staring at that. I'm going to use the light to check your pupils. Before we begin, his pupils are round and equal in both eyes. Now when I move my light tangentially, I watch both pupils for direct and consensual reaction to light. Okay, very good. I do this on both sides. Chad's pupils are equal and reactive. And now I'm going to do the cover and uncover test. Okay, so Chad, I again want you to choose a spot on the wall and go ahead and cover one eye. Very good. And now cover your other eye. All right, now while we were doing this, I was assessing for extraocular movement or nystagmus, and there were none. Okay, so now let's cover up your eye again. And I need you to, let me come over here, sorry. I need you to tell me when you can, oops, sorry. I need you to tell me when you can see my fingers in your peripheral vision.
See it.
Okay, good. Now let's just this side.
See it.
Okay, good. So Chad's peripheral vision is intact bilaterally. Now I'm going to check Chad's ocular motive abducens and trochlear nerve by having you hold your head still. And I want you to follow my finger in all 6 directions, noting any nystagmus or extraocular movement. Okay, so he was able to follow all 6 directions with no problems. Next, I'm going to move on to the inspection of the ears. I note that his ears are in alignment and similar in shape and size, and reasonably close to his head. Looking at his auricles, going to palpate, noting that there's no nodules or tenderness. Both auricles are firm. Now I'm going to go ahead and inspect excuse me, Chad's outer and inner canals with the otoscope. Going to very easily pull back, up and back with the henna. Noting that the tympanic membrane is pearly gray in color. There is good cone of light, no signs of bulging or perforations. And then the outer canal is not red, free of inflammation and discharge. Go ahead and look at me. We'll do the same on the opposite ear. Noting that the tympanic membrane again is pearly gray in color, no signs of bulging or perforation, and there is no redness or inflammation in the outer canal. Okay, so now we are going to test Chad's hearing with the tuning fork. We will first do the Rhine test. What I'm going to do is I'm going to gently tap the tines of the fork, and we are going to set it on the top of your head, and I want you to tell me when you can no longer hear it. Okay? Okay. And now we are going to do the same type of thing on these little bones behind your ear, and then I will move the fork out, and you will tell me when you can no longer hear it in either spot, okay? Okay, good. And we would do this on both ears, but for sake of time, we will just say that the other side was good as well. Now we will do the whisper test. I am going to whisper a word, and I want Chad to repeat it when he hears it.
Tiger.
We'll move on over to the other ear. Okay, good. So hearing is normal in both ears, and his air conduction noise was the air conducted noise was twice as long as the bone conducted noise, so that those 2 tests were normal, the Rhine and the Weber test. Now we're going to go on to inspect his nose, noting that it is fairly straight, midline, no obvious bony discrepancies here. I want you to go ahead and occlude one nostril and take a deep breath. Repeat on the other side. Okay, both nares are patent. I'm going to have you tip back a little bit so I can look up your nose, noting that there is no bleeding, discharge, and there is no inflammation of either turbinate. Okay, now we are going to inspect the mouth, noting that his mouth is again midline and his lips are not dry or cracked and pink in color. So, now when we open Chad's mouth, we will inspect the buccal mucosa, the gums, and the teeth. We're checking for pink mucous membranes, make sure they're smooth and moist. The gingiva is also pink. Go ahead and open. His tongue should be dull red with no lesions. Mouth is moist, buccal mucosa, oral membranes are pink, and all teeth are accounted for. There are none missing, no obvious signs of dental caries or cracked dentition. Okay, so now I'm going to go ahead and have you tip your head back again, and I am going to inspect the palate and the uvula. The soft palate and hard palate are continuous in nature. No lesions or signs of oral cancer on either of those. We go ahead and look underneath your tongue for the same thing. No obvious lesions noted. Go ahead and let me see your tonsils, which are in appropriate location, about 3 in size, no signs of exudate, redness, or inflammation. Uvula is midline. Go ahead and say ah. And the uvula remained midline with contiguous movement with the soft palate. The posterior pharynx was also, excuse me, smooth and pink while we were looking back there. No foul odor coming from the mouth. Now we will perform a gag reflex to make sure that the gag reflex is present, and we'll be testing cranial nerves 9 and 10 with this. So go ahead and sit down. Okay, good. Okay, so now I just want to do a light sensitivity touch test on your face, and then we'll be moving on to your neck. Go ahead and close your eyes for me, and let me know where you feel my Q-tip.
Forehead, left cheek, right cheek, chin.
Okay, very good. Okay, so now I am going to inspect the neck in the normal position, looking for symmetry of the trapezius muscles. Make sure that there is no webbing. The skin is smooth. Go ahead and look that way. There is no evidence of JVD on either side, which is good. I'm going to go ahead and feel Chad's trachea to make sure that that is also midline, and I'm going to palpate the thyroid, making sure that it's not enlarged, no nodules are palpated. And I want you to go ahead and swallow for me while I feel. Okay. Movement is smooth, and I'm going to have you shrug your shoulders, and go ahead and put them back down. Side to side, flex, and hyperextend. Movement is also smooth. I'm going to go ahead and auscultate his carotid arteries and his trachea for any signs of bruise or abnormal sounds. Okay, good. There were no bruise heard on either carotid or over his trachea, and his carotid arteries are strong and regular. Okay, so now I'm going to go ahead and palpate the lymph nodes. I'm going to start with the occipital, and we'll come down to the post-auricle, pre-auricle. Good. Going to come down to the submental, submandibular, superficial cervical chain, posterior cervical, deep cervical tonsillar, and we'll do the supraclavicular as well, looking for areas of pain, tenderness, firmness. Make sure they're neither too firm, not matted, or freely movable, and are not red or inflamed. Okay, so that was normal. I'm going to go ahead and assess Chad's upper extremities. Going to Inspect and palpate both arms and hands. Nail beds are pink in color. There is no sign of clubbing or cyanosis. Cap refill on both hands less than 2. Radial pulses are strong and regular. I'm going to go ahead and move on to the brachial pulse. Good. And while we're here, I'm going to gently roll the axillary lymph nodes. Okay, good. Okay, so there were also no rashes or lesions noted on Chad's skin, and it is pink, warm, and dry. I'm going to go ahead and have you slip your legs off of that side while I chest test your lungs. Okay, so all right. I'm going to again inspect the skin. It is free of lesions, rashes, pink, warm, and dry. Sorry. There are no bruising noted. The thoracic area looks symmetrical. And begin by coming down and palpating the costrovertebral areas. I'm going to go ahead and let me know if there's any pain.
Nope. Nope.
Okay, very good. And then to assess for thoracic expansion, I'm going to place my thumb on either side, the area of the 10th rib. I need to go ahead and take a deep breath. Okay, very good. My thumbs diverge, noting that the chest is symmetrical, and we're going to test for tactile fremitus now. I want you to go ahead and say Mickey Mouse.
Mickey Mouse.
Again.
Mickey Mouse.
Okay, very good. Again, please.
Mickey Mouse.
Okay. Vibrations were heard over each area when Chad was speaking. Now I'm going to test for resonance with Chad lifting up his arms. Go ahead and lift up over your head. There you go. And I am going to percuss, listening for resonance. And I am listening for resonance throughout the chest. Okay, good. You can put your arms down. All right. Now to assess for diaphragmatic expansion, I'm going to have Chad take a deep breath and hold it, and I will percuss along the scapular line, noting the point where a change in resonance changes from resonant to dull, and then I will mark this spot. Go ahead and breathe. And we're going to go ahead and repeat on the other side. Okay, go ahead and breathe. And then I am going to go ahead and measure this, and the distance between both spots should be between 3 and 5. Okay, yours is 4.5, so that's good. Okay. Now I'm just going to listen to your posterior chest. I'll compare your lung sounds from side to side, noting any adventitious lung sounds. Every time you feel my stethoscope hit your back, if you could take a deep breath. Okay. All lung sounds were clear and equal bilaterally, no adventitious lung sounds. Go ahead and throw your feet back up on the bed. Okay, so we're going to come around to inspect the interior chest, exposing Chad a little bit, noting that there Skin is even, pink, warm, dry. I'm going to go ahead and palpate the infraclavicular area for any masses, hard lymph nodes. Palpate the chest starting at the apex. I'm going to move over, down. I'm going to feel for apical pulse. Okay, very good. I'm going to listen to Chad's lung sounds laterally, and then I'm here, and then I will go ahead and listen to his heart tones. Deep breath. Again. Okay, good. Now you can breathe easy. I'm going to listen to your heart tones at the aortic spot, pulmonic, Herb's point. Very good. Tricuspid and mitral. Okay, heart tones are normal, S1, S2, no ectopy, S3, S4, gallops or murmurs noted. I'm going to go ahead and lay you back so we can assess your belly. Go ahead and inspect his belly, noting that it is round, not concave. His ribs are not visible. Skin is pink, warm, and dry. No bruising, and no obvious masses. Okay, so then I'm going to listen to all 4 quadrants, noting that all vowel sounds are present, neither hypoactive or hyperactive. While I haven't set this up, I'm going to go ahead and listen to his aortic artery. Both sides of the renal arteries, iliac, femoral, there are no release noted noted over any of the arterial sites. I'm going to percuss for tone, expecting dullness over the solid organs. Okay, and then I am going to lightly palpate, feeling for any areas of pain or tenderness. And then upon deep palpation, you let me know if any of that hurts. While I am palpating, Chad tenses up, and I can note that his abdominal muscles are free of hernia. No masses or hernias noted during palpation. We'll go ahead and do your kidneys. Pain or tenderness? Pain or tenderness? Okay. And then we are going to deeply palpate in the left costal margin for the spleen, which I should not be able to feel, and I don't. And then we will go ahead and assess for liver size. Slowly go up the clavicular line and percuss until we hear resonance. We will mark that spot, and then we'll continue to go down and mark the spot where we no longer hear the resonant sound. We'll go ahead and it's about 8 centimeters, and between 6 and 12 centimeters is normal liver size. Okay, so let's see. Okay, we can go ahead and sit you up. We're going to go down to Chad's legs. I know the skin is warm and dry. There's no easy bruising. Hair distribution is even. Good muscle tone. The muscle masses. Go up and feel femoral pulses, which are strong. And we'll go to the the popliteal pulses, and then down to the posterior tibial pulses and his dorsalis pedal pulses, which are all present and strong. Cap refill on his toes is less than 2. Okay, and then we will go down and have Chad swing his legs over so I can check his reflexes. First, we'll check for brachial. Okay, good. We'll move down to his knees. We'll move down and do his Achilles. Okay, good. And then we can have you sit your gown back on. Go ahead and stand up and face that way so I can assess your cervical and lumbar spine. Go ahead and bend over a little bit. And there is no curvature, there are no step-offs, no area of tenderness or areas of pain. You go ahead and sit down. One last thing I want you to do is just test your strength real quick. I'm going to have you pull me towards you. Push me away. Push up. Push down. Okay, very good. So this concludes our 30-minute assessment. I'd like to thank Chad for being my willing volunteer, and thanks for watching.